So one big concern with vaccinating cats is the potential for causing tumours. So that sounds really severe, but just how common is that? What's the chance of your cat developing a tumour because of vaccination? And actually, is it vaccination that's causing these tumours in the first place? And the final question on today's show is from Ken Toomer, who writes that their understanding was that the majority of injection-related sarcomas were linked to the use of adjuvants in vaccines, which unfortunately are still used in some veterinary practices despite the existence of safer non-adjuvanted alternatives. But what really is the truth behind that? And this question comes after another one of my videos and questions about side effects of vaccinations where, I did talk about injection site sarcomas rather than vaccine related sarcomas. So cats get this phenomenon called injection site sarcomas or fibrosarcomas. They develop in about 1 in 10,000 to 30,000 vaccinated cats. So, they really are very rare, but they're a real risk. Now, it was first thought to be completely vaccine related, that vaccines were responsible for causing these tumours in these unfortunate cats. But it's now become much more clear that it's actually just the act of having any form of injection that can trigger the cancer formation. So it may be just the fact of the needle going in, or it may be the injection of any substance that's triggering this cancer formation. It's not just vaccines. Now, vaccines are just the most common injection that most cats will get. So, certainly in our younger cats, they're, really not going to be getting many other injections at all. So the vaccines may make up a reasonably large percentage, if you like, of vaccines. Again, certainly while they're young. Now, the role of any adjuvants, as Ken Toomer kind of suggested, are adjuvants the cause? Well, that really is unclear, and that's including aluminium adjuvants or any other adjuvants. It's really not clear that they are responsible to any greater degree than some of the other things that are causing this problem. Now, potentially these tumours are more likely following leukemia and rabies vaccinations, but they've also been found to develop after a range of different other drug injections. They've been found around suture material that has kind of dissolving suture material after a surgery. So that could be a mass removal in the first instance, or it could be a stitch up for a wound, whatever reason that there's been some suture material used. There's even been one case of injection site sarcoma following microchip implantation. So the bottom line is that really anything can cause this. It may be that some adjuvanted vaccines, so our leukemia and our rabies vaccines, are more likely to cause this. But the bottom line is, the risk is really very, very small. So only about 1 in 10 to 30,000 cats being affected. Now, like I say, the cause is unclear, but it is thought that just the inflammation that can result following the injection of any substance or the act of having a needle and act of being injected is actually just not controlled properly. So is there an actual problem within a certain line of cats? Are certain cats genetically predisposed to getting that, or genetically more likely to get this compared to other cats? But whatever is happening, this inflammation may be resulting in cell mutation and then cancer formation. So, what are we looking for? Well, a small lump immediately following vaccination or any injection is really not unusual, but it shouldn't persist for any longer than a couple of weeks. And we can think about something called the 3-2-1 rule. So that is, if something is persisting after 3 months post-injection, if the size is larger than 2 centimeters at any time point, so if it's got to 2 centimeters either straight away, or if it's growing and it's got to that size, or if it's increasing in size 1 month following injection, then those are all triggers that this could be something that we need to be aware of. Now, in most cases, if we've got a swelling after injection or after vaccination, it's going to be smaller, it's not going to be persisting for that length of time, and it's not going to be increasing in size a month after injection. So those are all things that are not going to happen in a normal case. So if those are happening, then we really absolutely need to get onto it kind of straight away at the earliest opportunity. And the reason for that is that these cat injection site sarcomas, they really are aggressive tumours that need prompt, really aggressive surgery as well. Now, ideally, they're going to be guided by CT or MRI scanning, just so that we can see the exact nature of the tumour. We can try and work out exactly where it is so that we can remove it completely at surgery, because it's sometimes the case that little tendrils, little tentacles, if you like, are sent out in different directions, which are very difficult, if not impossible, to pick up either before surgery or even during surgery. So if we can get some advanced imaging in, then we're going to have a much better chance of removing it completely. Now, after surgery, there's then the potential for other follow-up treatments, and that's like chemotherapy or radiation therapy. And that's really going to depend on kind of the surgery, how that went, and what resources are available in your area, as well as costs as well being a consideration. But the bottom line is that these are invasive tumours. They're really nasty tumours. They're quite aggressive, and there's a high risk of recurrence. So like I say, a lot will send out little tentacles, and it's very difficult to get every single tumour cell, which means that will come back. So that highlights again why we want to be getting onto this at the earliest opportunity, just to give ourselves the best chance of removing it completely. And then finally, 25% of tumours, so 1 in 4, will actually metastasize, which means they will spread to other parts of the body. And once that happens, that's really bad news. Now, as a result of feline injection site or vaccine site sarcomas, tumours, then there has been a move to change where we're actually injecting cats, and that's moved from the scruff. So typically injections would be at the scruff, so between the kind of shoulder blades. There's lots of skin there, it's not very sensitive, so it's a great place in theory to inject a cat. But we're trying to move to the lower thigh or to the lower front leg if possible, because that's going to make any tumour easier to completely remove through amputation. And while that might seem really extreme, it's very difficult to remove this tumour, as I've said, in its entirety. And actually cats will do very, very well with 3 legs, and often that's going to be a case of a 3-legged cat is going to survive, whereas if we're trying to remove a tumour from somewhere else, it's very likely that we're not going to get it all. It's going to come back and it's going to spread, and it's going to ultimately result in the death of that cat. So there has been a switch to inject our cats in slightly different areas, just to reduce the impact of an injection site sarcoma, an injection site tumour, should it happen. But remember, this is a really very rare thing, and we can't lose sight of the fact that we're giving these injections for a reason. A lot of the diseases that we're vaccinating against are really life-threatening or life-limiting, or have a massive impact on quality of life, and are very common as well. So we don't want to have the extreme reaction of saying vaccines are completely unnecessary, and we don't want to risk our cat getting a tumour. Now, that said, we also do want to give our vaccines at an appropriate interval. We don't want to give more vaccines than our cat needs based on their lifestyle, and we don't want to give them more frequently. And that's something that I'm actually going to discuss in the next episode of the Dr. Alex Answers show.
You've been watching the Dr. Alex Answers video podcast. Remember to subscribe and head over to dralexanswers.com for any links, downloads, and get your question answered.